What's up, everyone? I'm Dr. Josh Aguda. Today I want to talk a little bit about shoulder dislocations and how to kind of do a small little self-assessment to see if you're suffering from that. So first things first, when we're talking about shoulder dislocations, we're really talking about the instability within the joint here in their shoulder. And a lot of times this happens in trauma, but a lot of people also have what we call recurrent dislocations and chronic instability. And oftentimes that needs to get corrected, sometimes by surgery, sometimes by an extreme rehabilitation program. But either way, this little self-assessment can help you. The younger that you are and the more times you have this dislocation, the more problems you're going to have. So keep that in mind, and the more likelihood that you probably need to take care of this, possibly medically or surgically, to stabilize the joint. But that being said, if you are sleeping and you constantly wake up with a subluxation or a dislocation, even if it's partial, that's a good sign that you may have chronic instability or a dislocated shoulder. Another test that we can do is we call it Dugas, and a lot of people will not be able to reach across their body. If you can reach across the body, some people will cheat like this, but I want you to take your fingers and try to touch the opposite shoulder. If you can do that, then you probably don't have this. But if you add this movement going up and down, it may be very, very difficult for you to do. And I'm not telling anybody out there right now to do this, because if you get into this position, you may feel it subluxate or begin to dislocate. And that's a good indication that you may not have it, or that you may have a dislocation or partial dislocation. Also, another common test is the baseball thrower, or we call it apprehension sign or test. And what we're trying to do is put our arm like this, okay? As we put our elbow equal with our shoulder, and then we start to externally rotate and pull this backwards, the stability of our joint starts to decrease. If there's decreased stability, that means there's going to be a lot more chances for that to subluxate. And what we're really looking for when we test this is what we call apprehension. Some people, and I've actually seen this, people will go like this, they'll like look at you like you're crazy, like you're about to do something really extreme. And if you are one of those people that start to feel it start to go out like here, don't even try to bring it out here. So this baseball thrower position can increase that subluxation and that dislocation. So those are 3 things that you guys need to keep in mind if you're somebody who's suffering a dislocation, or if you want to assess or do a small little self-assessment to see if you're actually having a dislocation. But make sure, guys, if you're having this issue, 1, you try to take care of it as soon as possible, because we don't want recurrent dislocations. And 2, if you need to, really seek some care, seek some therapy, seek some medical advice, because this is not an issue to be taken lightly. Because when you have a dislocation, not all the time, you can impinge upon the neurovascular structures that are within the shoulder and that joint. All right, guys, I'm Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys for the next episode. Take care.